tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk about a history of depression or anxiety before pregnancy and how it affects pregnancy. So, if you have depression or anxiety in pregnancy, first, know that it is a chemical imbalance. It's not caused by a hormonal imbalance. It is a disease just like hypertension and diabetes. And so it deserves treatment just like hypertension and diabetes. So if you treat high blood pressure or diabetes, then you prevent long-term complications from it. Likewise, if you seek help and you treat anxiety or depression, you prevent long-term complications of that disease process, such as having suicidal thoughts or a suicide attempt or a successful suicide. So I want to encourage you to seek help when you have those symptoms. And if you have a loved one that has those symptoms, please encourage them and support them in seeking help. If you feel like the room is caving in on you, you're having panic attacks, you feel overly anxious and you have no idea why, or small things make you very anxious, you may have crying or anger outbursts, those can be symptoms of anxiety. If you have a depressed mood, you cry a lot, you feel down, you no longer have joy in things that used to give you joy, you have problems with sleep, you have weight gain or weight loss, or you have anxiety symptoms as well, you could also have depression. Those things deserve attention. So if you have symptoms such as those greater than 2 weeks, then you could have the diagnosis of depression, and that deserves treatment. So please talk to your healthcare provider as soon as possible if you're experiencing that. The biggest thing in treating depression or anxiety in pregnancy is knowing if you have depression or anxiety before the pregnancy starts. If you're on medicines for depression or anxiety in pregnancy, the key is knowing if it's safe in pregnancy before the pregnancy starts. So if you watched my previous video, you would know that most of the time people don't know they're pregnant until they're almost in the second trimester. Organs are forming early in the pregnancy, weeks 3 to 8. And so that's usually when you've just missed your period by a couple of weeks. So knowing what medicines are safe in pregnancy before the pregnancy would be helpful. So if you're thinking about getting pregnant, let your provider know, hey, I'm thinking about getting pregnant. Are these medicines safe in the pregnancy? That way, they can switch you to medicines that are safe in the pregnancy so that you can successfully get through the pregnancy without having an increased risk of having a baby with structural malformations or birth defects. Don't panic. If you're on medicines and you've already gotten pregnant, it's okay. Most of the medicines that treat depression or anxiety nowadays only cause a very, very small risk of birth defects. Most of the time, there are no studies that definitively say or definitely say there's an increased risk. And the studies that do tell about certain drugs with an increased risk, those risks tend to be very, very small. So I don't want to cause you to panic because 9 times out of 10, your baby is safe. But to decrease that risk, talk to your provider before you get pregnant so that you can switch medicines. Even if you've switched medicines during the pregnancy, if you were coping better with another medicine, once it's a safe period in pregnancy, your provider may recommend switching back to the medicine you were on before. Usually the safe period of switching back is after the first trimester or once you turn 13 weeks pregnant. It would be safe to switch back to whatever medicines you're on if your doctor deems that they are safe in the pregnancy. There are certain medicines that can cause an increased risk of birth defects in the first trimester. Most of those birth defects deal with a small increased risk of heart defect as well as facial clefts or cleft lip and cleft palate. But most of the time, the first line drug for depression or anxiety is usually SSRIs or selective serotonin reuptake inhibitors. And those tend to be generally safe in pregnancy without consistent studies that show harm. Most of the studies with drugs that treat anxiety and depression, we have to go off of animal studies because there's not enough human studies. So please talk to your OBGYN. They may send you to somebody like me who's a maternal fetal medicine specialist to review each one of the drugs that you're on specifically to tell you whether or not they're safe to continue during the pregnancy or if you need to talk to your psychiatrist about switching your medicines before or during the pregnancy as well. So we talked about making sure you know if you have the diagnosis before so you can switch meds. So during the pregnancy, you do have an increased risk, even if you're on medicine, of having a smaller baby. So let's say you're on medicines during the pregnancy. Your OB would send you to somebody like me who would look at your baby from head to toe to make sure you are not in that category of people that may have a birth defect. Like I said in previous videos, once you have been ruled out for major birth defects, you can't go back and make a major birth defect. So breathe once you get a normal anatomy scan. There are certain defects that can't be diagnosed until much later in the pregnancy, but those are very, very small defects and very, very rare. And your maternal fetal medicine provider will let you know if you need to come back to be screened for those, depending on what medicines you're on. Some patients that have a history of depression or anxiety or any mood disorder can have an increased risk of having a smaller baby. Some medicines that treat those things also increase your risk of having a smaller baby. So your OBGYN would recommend you do growth scans once your baby is viable. Viable means that your baby has a chance of surviving outside of the womb without you, and usually that is around 23 to 24 weeks. And so you will be referred to somebody like me, or your OBGYN may do screening themselves to check the growth of the baby periodically through the third trimester. Even if you're not on medicines, because some people say, well, Dr. Plenty, I don't want that risk, so I don't want to be on any medicines. Well, if you're not on any medicine and you're having symptoms, studies tell us that you have an increased risk even beyond the risk of somebody on medicines, because people that have a depressed mood or maybe anxious and they're not treated for those symptoms don't treat themselves as well. They have a higher stress level. We know that stress is related to an increased risk of preterm birth and preterm delivery. Can also cause your baby to have failure to thrive or not do as well after delivery. And your baby can also have a low birth weight. And sometimes that may be linked to poor nutrition, because people with depression or anxiety don't eat the things they need to eat because they just don't have an appetite. And so you have to weigh the risk versus the benefit of being treated during pregnancy. And so I always tell my patients, if you're healthy, your baby will be healthy. And so the best thing you can do for your baby in pregnancy is to be the best you possibly can, to be the happiest you possibly can. And if that takes you being on small dose of medicine to keep you happy, then we know that your baby will thrive better. After delivery, if you have a history of anxiety or depression, even if you're not on any medicines, even if you had no problem during the pregnancy, you do have an increased risk of postpartum depression as well as postpartum psychosis. Psychosis means that you may see things that other people don't see. We call those visual hallucinations. You may hear things that other people don't hear, or auditory hallucinations. You may feel things that other people don't feel, such as somebody touching you or feeling like something's crawling on you. Those are tactile hallucinations. So you have an increased risk of those things happening with those diagnoses or any mood disorder, even if you are stable throughout the pregnancy. And so that is psychosis. Additionally, you could have depression symptoms after delivery. If you have symptoms within 2 weeks, we call that postpartum blues, if that goes away after 2 weeks. Now, if you have it 6 weeks or more, then we know that that's postpartum depression. And so you need to be screened thoroughly and periodically through the pregnancy and early in the postpartum period. Typically, I usually recommend that patients are seen 1 to 2 weeks after delivery to be screened, and then again at your 6 weeks postpartum period to make sure you don't have any symptoms. I also encourage my patients to go ahead and schedule an appointment as soon as we know when you're going to deliver, within 2 weeks of delivery with your psychiatrist. It's very, very important for you to continue being screened by your behavioral health professional, whether that is your counselor, a social worker, your psychiatrist, to make sure you're getting cognitive behavioral treatment, so some type of therapy or counseling, in addition to medication if it's needed. The key is making sure we monitor your symptoms to make sure you don't need to be on higher doses of medicine or needing other types of treatment to prevent you from having an overwhelming sensation or overwhelming feeling or feeling down or as if you can't cope with your baby. Symptoms of feeling overwhelmed can be very normal, okay, without having a diagnosis of depression or anxiety. I have a 7-month-old. If you watched the last video, you saw him at the end of the video. He's active, he's a joy, but it's different. You're not getting as much sleep. It can be very overwhelming to be a mom, especially if you're a first-time mom. So please, don't be embarrassed to seek help. Don't be embarrassed to say you're overwhelmed. And your OB will let you know, okay, this is normal, or hey, this is not normal, okay? And they will likely bring you back to see how are you coping over, the span of a couple weeks after you have the baby. Because you need all the help you can get, and you need to make sure you're coping and adjusting as quickly as you possibly can. Also, another thing I would encourage people to do is do not be afraid to ask for help from family members, from friends. People suggest, I can come and help keep the baby for an hour, or hey, do you want some time to go get your nails done? Please take people up on that. Oh my goodness, I can't stress it enough. You need time to just be yourself. You need time to get back to you after you have a baby. And sometimes you can feel guilty about leaving a baby, especially if your baby's only, 4 to 6 weeks old. But trust me, just taking an hour to go get your nails done, get your hair washed, take a walk around the block, gives you time to mentally debrief so that you can be the best mom that you possibly can be. Please, make sure you date your husband. Make sure you go out with your spouse or your boyfriend or your loved one, because having somebody there to just debrief and talk to without your baby being around is very important to getting back to what's normal for you. And if you have a history of depression or anxiety already, please take time for yourself, date your significant other, and get back to being you so that you can be the best mom you possibly can. I can't stress that enough. Please don't feel guilty taking time for yourself. So in closing, depression and anxiety is really common. 1 in 4 people have depression or anxiety in their lifetime. 23% of women experience symptoms during the pregnancy. Please seek help. And please let your provider know what you're going through and what you feel so that we can get you safely through the pregnancy and so you can enjoy your baby. Thanks for tuning in. If you have any questions, please email me at pregnancypearls@gmail.com. The little button below, I know I say it on every video, please click and subscribe. And if you have any suggestions or anything you want to hear, please email me, or you can drop a line on the blog. Go to www.pregnancypearls.com. Thanks for tuning in.